형님
On the left or right side?
약간 고민형
Right side, so
같네요.
turn on your left.
컨셉.
Oh,
아니 쌤 말이 쌤.
so, origin and insertions, we know, come here from the thorax, from the ribs, 1 to 9, and it goes to the angulus superior, to the middle border, to the angulus inferior of the scapula. And if you see this, it's a very, very large muscle. Very, a long muscle.
지시점들을 잘 살펴보면은 생각하는 것보다 요 정도 사이기 때문에 굉장히 넓은 근육입니다.
We have a little problem.
Had a little problem.
We have a little problem.
요거는 조금 문제가 될 수가 있는데.
Which one? Here is the scapula and the latissimus, and you see I can touch it directly just in a very small part, and here I have a problem.
그래서 스캐폴라랑 라티스모스가 덮고 있기 때문에 이걸 직접적으로 만질 수 없는
So
문제가 있고요.
I have to deal with this problem. I have to understand it. When I press here, I'm not on the serratus anterior, I'm on the scapula. So first thing is to realize the dimension of the muscle, and then please come back with your hand here. Yes. And when I go now back with the shoulder, you see I can dissolve a part of this problem. By moving back, this area where I can reach the muscle directly is much bigger than if the shoulder is in protraction. So first thing is to make the retraction of the shoulder. Then I have more access. This is one benefit. And the second benefit is
여기 써 있어.
the muscle. If you go back with the shoulder, the muscle is stretched. And in the stretched muscle, it's more easy, much more easier to find taut bands than when the muscle is not stretched. So you have two benefits if you go back. And then we go perpendicular to the taut bands, and we are looking. Do we find fibers here, for example?
이 포지션을 하면 이게 두 가지 이점이 있습니다. 아까 가려져 있던 부분이 치울 수가 있고 스트레칭 되니까 좀 더 쉽게 만지고.
Okay. And making this exploration, I feel it is a sportsman, it's an athletic, it's a climber, or it's a person which doesn't often use the serratus. The serratus is very, very different. Sometimes it's very easy to feel it, and sometimes you think there is no serratus anterior, or little serratus. But here I have fibers. It's okay? Okay.
세라투스 안테리오 같은 경우에는 운동 선수처럼 혹은 운동을 엄청 많이 하는 사람들 아니면은 굉장히 찾기가 힘들다고 합니다. 거의 세라투스 안테리오가 없나 생각이 들 정도로.
Okay. So here this needs time. You go slowly, step by step, and I follow first the ribs, because to press the serratus against the ribs, then you can provocate the pain. If you go in the intercostal area, it's very difficult. It's not so clear. So first you go over the ribs and you are looking, are there taut bands, are there fibers you can identify. Okay.
갈비 사이에서 뭔가 계속
Here
누르려고
again I
하면
have such a fiber.
찾기가 힘들기 때문에 일단은 처음에 찾을 때는 갈비 위를 위주로.
Sorry.
죄송해요.
Snapping palpation. Here I can feel very well these fibers. Okay. This is first approach. You go back and you take the part ventral from the latissimus dorsi. Second approach is you go in front of the patient
엎드리시면
엎드려
돼요.
볼까요?
No, no, you rest. You rest.
환자 앞에서
네? And you go as high as possible with the bed. You use the infrastructure. It's a very good infrastructure here. So please use it as high as possible. Okay.
침대 칭찬이었습니다.
And then you take body lotion. If I take body lotion, you know now I will perform technique 4.
네, 바디밀크를 쓸 건데요. 이제 알겠죠. 바디밀크를 내가 썼다는 말은 내가 4번에 쓰겠다는 뜻이랍니다.
I go in this position. I look, this is more or less parallel to the floor. And now I have here the latissimus. I have to look. Where is the shoulder blade? It's here. Okay, here is the latissimus. Top. And I go ventral from the shoulder blade. I take massage body lotion. And then I pull the shoulder blade, the shoulder, over 2 or 3 fingers. My fingers are on the serratus, on the ribs, and I pull the shoulder over my fingers. And then you go back with your right, left hand, and the shoulder, with all 3 together. Right hand, shoulder, and my left hand. Then my left hand stays, and I pull the shoulder over my fingers. Okay? So I enter this subscapular gliding space. Yeah.
지금 요거 같은 경우는 어떤 느낌으로 하는 게 좋냐면 그냥 당기는 것보다는 어깨뼈 면에 잡고 왼쪽 손가락 위로 이렇게 덮는다는 느낌으로 당겨 오시면 되겠습니다. 그렇게 해서 이제 스캐폴라랑 소락스 사이의 공간을 글라이딩 시키고 있는 거고요.
Exactly. And then I go back with my right hand, left hand, and the shoulder. I rest here with my left hand, and with my right hand I pull again the shoulder over my finger. And so I enter step by step in this scapuloturbo gliding space.
그래서 아까랑 같은 내용인데, 자 당길 때는 위로 이렇게 당기고 갈 때는 둘 다 같이 갔다가 다시 머무르고 당기고 갔다가 다시 머무르고 여기만 당기고 이런 식으로.
And then I move. It's a separation technique 4 serratus anterior and subscapularis. It's okay?
지금 서브스캐폴라리스랑 세라투스랑 분리시키고 있습니다.
I can dislocate a little bit and make the same. I go back, I pull over, and it's okay? Okay. This is the facial separation technique. If I go inside and I go down with my fingers, I will press on the serratus anterior and see how is the reaction. It's worse.
발걸음.
그러면서 반응 보고.
Okay. And I'm looking, is it possible to find active trigger points? If I turn my fingers like this, and I take the shoulder over my fingers, I perform also this facial separation technique. And if I make now flexion with my fingers, I will reach to which muscle?
이렇게 하면은 어떤 걸 잡을 수 있을까요?
Exactly. And you see, it's a continuation from the treatment we made yesterday for the subscapularis on the back side. On the lateral side, it's very comfortable also to perform.
어제 서브스캐폴라리스 할 때 보여줬던 거의 연장선인 기술입니다. 가쪽에서 어제 연습했던 것도 효과적일 수가 있는데 이것도 편안하게 할 수 있는 기법 중에 하나고.
So, like this for subscapularis, like this for serratus anterior, and this means the techniques we made yesterday for subscapularis, it's vice versa. You can turn the finger on when the patient lies on the back side, and then you are on the serratus.
그래서 어제 이렇게 서브스캐폴라리스 할 때 우리가 3번은 따로 이렇게 적용을 하지는 어렵기 때문에 그 내용에 대해서 얘기를 하고 있습니다.
Okay. this is second part. Third part is I go to the cranial slides of the serratus. I'm now here back again. I go down with the bed. It's okay. Position is possible. For me, it's very comfortable to use my body, my part here, as third hand. So I have one hand here to fix, one hand here, second hand, third hand is here, and this is my fourth hand. So I have four hands to manage this. It's very comfortable position. Because if I make like this, there is often a tension in the arm because it's not comfortable to hold in this position. So I can stabilize here. Okay. And now I take body lotion and I go here in the axilla, and step by step I go to the second, third, second, probably first rib. This looks a little bit crazy, but we will ask him.
맨 처음에 했던 거는 지금 잘 보시면은 여러분들 나중에 실습할 때도 이렇게 받치고 있는 부위를 잘 보셔야 됩니다. 여기서 하나, 여기서 둘, 여기서 셋, 넷 해가지고 이제 노 선생님 표현으로는 나는 지금 4개의 손으로 치료를 하는 것과 마찬가지다. 그래서 여러분들도 이거 나중에 연습할 때 저 포지션을 맞춰야 되고, 여기서 엄지손가락으로 선택을 해서 들어가는데 상상을 해서 첫 번째, 두 번째, 세 번째 갈비 방향으로 깊숙하게 들어가야 됩니다.
For me, this works well. If it doesn't work for you well, you can also take a cushion and put the arm in this position. But it has to be comfortable for the client, that he don't has to hold his arm, because if he has to hold it, the weight of the arm, I can't reach here inside.
그래서 뭐 만약에 환자가 이 자세가 너무 불편해가지고 이 자세를 만들고 싶을 때는 베개를 받치던가 끼우던가 해가지고 치료를 진행해야 되는데, 그 이유가 만약에 베개를 안 받친 상태에서 뭐 이런 식으로 환자가 자세를 만들면은 힘이 들어가가지고 이런 식으로 컨택하기는 힘들다고.
So with my thumb I feel the rib, the intercostal space, the next rib. It's okay for you. It shouldn't hurt at the moment. It looks a little bit strange, but it doesn't hurt because I don't press. I'm looking for the way with the littlest resistance.
지금 이제 눌렀을 때 안 아프다고 한 게 맞는 게, 지금 그냥 길을 찾기 위해서 그렇게 큰 저항, 큰 이렇게 압력을 넣은 게 아니기 때문이라고.
And you see with elevation, I reach more and more higher and higher here in this area.
지금 이렇게 길을 찾으면서 동시에 엘리베이션을 점점 높게 가져가고 있습니다.
When it's not possible to get further, then I rest here and I go back more again, and then there is again a stretch on the serratus by this movement back.
그래서 점점 올려가다가 이제는 뒤쪽으로 이렇게 당겨서 세라투스 안테리어가 좀 더 늘어나게
And
보시는 겁니다.
now I go with my finger in the direction to the angles, to the superior angle of the scapula.
이 상태에서 지금 이제 엄지 손가락은 이제 어깨뼈 윗각 방향으로 가고 있고요.
And now start the hurting part of the procedure.
이제 만졌을 때 좀 아픈 부위에 도달을 했습니다.
It's okay. And here I'm looking for painful parts in this upper part of the serratus anterior.
지금 이 세라투스 안테리어의 상부에 도달을 했는데, 여기서 이제 조금 만졌을 때 아픈 포인트라고 합니다.
Okay. You see like this. In this direction I change a little bit. It's okay?
네, 조금 이렇게 방향을 바꿔가면서 이렇게 할 수 있고.
Now here it's not possible to make a technique 3. It's not enough space, but I want to release after the treatment, and one possibility would be to move like this.
지금 이제 3번을 적용을 할 수는 없지만 그래도 내가 이완을 뭔가 하고 싶을 때는 이런 방법도.
In this position. Does it hurt?
뭔가요?
It should hurt now at all.
혹은 이런 방법도 이용을 해주고.
It should feel comfortable after the treatment to release.
치료를 해서 이렇게 이완이 되면은 편안함을 느끼고 있는 거죠 지금.
It's okay? Okay. So, please try.
자 가봅시다.
Thank you so much.